Yes, that recording got delayed. So some of the questions regarding the sevenfold classification, some of them were posted in the group, but some of them were asked personally. So I was a little bit wondered because I never thought that it will be creating such an enthusiasm about what is happening, or what is the relevance of such a classification, how we can accommodate that sort of disease here, this sort of disease here. So I thought at least a couple of them need to be highlighted or explained a little bit more. Sahaja, I think Sahaja, we have already explained something. Something we have explained, but there are many other things which can be found relevant as in the practical field. That is also very important, isn't it? And while looking at one example, what we saw, it was about the arshas, but it need not be about arshas. It can be about any disease. And arshas we saw, Vali Bijopataptidaha, then Vali Bijopatapti is because of the Mada Pitrapacharadaha, then Sannipatakopam, Asadhyani, Evamakyada, Sarve Roga, Kulodbhava. But any disease can come into this category. So it is not limited to arshas. So we should look into, in our practical, on our clinical setting, we should be looking into the possibility of this sort of a sahajam. And also we saw the difference, or the two aspects, sahajam and the kulajam. Kulajam tends to run in the family beyond, I mean, or what should I say, it is not restricted to just one father and mother, or sometimes one particular father and mother need not be involved in the causation, but it tends to run in the family. So then I think it should be more specifically named as kulajam. Sahajam is just from one particular generation, from particular father and mother, it initiates. Whether that is going to be kulajam, we have to wait and see. Unless and otherwise, proper care is taken to prevent that flow, definitely it is going to become kulajam. Then at one particular point in Sushruta Samhita, that is very interesting. If you look into Prameha Chikitsidam in Sushrutam, the very chapter begins with a very bold statement. What is that bold statement? Dvau pramehau bhavataha. So it is something like a very categorical statement. There are two types of pramehas. When you generally look into the textbooks, I think sometimes these sort of a categorical statements need not be seen very often. But here it is a very categorical one. Dvau pramehau bhavataha. The very chapter opens with that statement. So it is something like a pradijna. So Sushruta never intends to violate from that statement. This is my understanding. This is what my observation. And the classification goes like this. What is it? Sahajaha apathya nimittataha cha. Sahajaha, one, apathya nimittaha. Second one is apathya nimittaha. So here we get the two classifications actually. Sahaja pramehaha, apathya nimitta pramehaha cha. And then he is explaining what is that. Tatra sahajaha madru pitru bija dosha kritaha. Tatra sahajaha madru pitru bija dosha kritaha. Ahidaharajaha apathya nimittaha. That we will come to later. So, when there is madra pitra bija dosham, so here we find it as a very bold statement by Acharya Sushruta as do pramehau bhavataha. But I think this may be the case with Vadashonidam, Kushtam, Rektavittam, Raja all these things can be there behind. Even I think from Jwara to Vadashonida, any context you can fit this statement. Sahajaha apathya nimittascha. Two types. When, what is the relevant, what is the things which are playing behind this? When there is a, so bija dushti is the context. And that is where we can intervene. One of the questions that I had the other day was how we can intervene in this. So if we understand that, okay, there is a space to intervene as far as a Vaidya is concerned, this classification is becoming relevant, clinically significant. So where we can intervene? So that was one important question. And generally we say that when there is Bija Dushti, when Bija Dushti, there is no chance of conception itself. There is no chance of pregnancy, isn't it? Bija samartham redosram. That is what we find in Vadadi kunabhagrandhi Shina Puya Kshina Malahvayam Bija samartham Bija asamartham redosram. So there is no question of conception. But that need not be the case all the time. When there is a widespread and grave bija dushti or dosha dushti happening in the level of Stri Bijam or Purusha Bijam, it is true that there is no possibility of pregnancy. But that need not be the case always. When the dosha dushti is partial, that means incomplete or mild, then the conception may take place. Pregnancy can happen. And in such case, there is every possibility of a sahaja vyadhi caused by this peculiar dosha dushti, which is partial. Partial means affecting a particular bija bhaga. Interestingly, I think acharyas are everyone. I think our four acharyas, all the ancient acharyas have made a very serious note of this possibility. Especially Acharya Charaka is making a wonderful observation in this regard, which should never be overlooked. He is explaining the possibility of such a happening in the male as well as in the female. It goes like this. I will not be going through all the textual detail because I have to come back to the practical application of these things. Yada striya dosha prakopanoktani asevamanaya. So dosha prakopanoktani asevamanaya striya doshaha prakupitaha shariram upasarpantaha, spreading over the shariram, shonida garbhashayau upapadyante, when they reach the shonitam and the garbhashayam of that stree. So two aspects, the garbhashaya as well as the bijam. Nacha kalsnena shonida garbhashayau dushayanti. The dushti is not full-fledged. Karsnyam, complete. So, nacha karsnena shonida garbhashayau dushayanti tada iyam garbham labhade stri. Then definitely conception, this woman gets conceived. Tada iyam garbham labhade stri tada tasya garbhasya madrijanam avayavanam anyatamaha avayavaha vigridimabhadyate. Tada, then tasya garbhasya, as far as that particular fetus is concerned, madrijanam avayavanam anyatamaha avayavaha, among those avayavas which are identified as madrijam, mrudvatra madrijam, we have learned what are the Madruja Bhavas in the Garbha. Anyatamaha Avayavaha, one among those Avayavas, Ekaha Vikritimabhadyate Athava Anekaha. So that can get afflicted. One avayava or multiple avayavas among the Madruja avayava bhavas can get afflicted, and yasya hi avayavasya bije bija bhage va doshaha pragobamabhadyante tam avayavam vikritihi avisati. So yasya hi avayavasya, of which all avayavas, bija bhage va doshaha pragobamabhadyante. In the bija or in the corresponding bija bhaga of which all avayavas doshaha pragobamabhadyante, the doshas get involved. Pragobamabhadyante, the doshakobam is getting involved. Tam avayavam vikritihi avisadi. Those avayavas get afflicted by vikriti, they become vikrita, causing the manifestation of certain specific vikaras of that particular avayava. So this is a very beautiful narration. This gives us an idea to nourish our prajna. This is how it should be looked at. This is how the history of such an incident or such a background is to be looked at. Then next we find Annarasajam. Annarasajam, we will come to it later because it is again going to be a very elaborate discussion while we go through the Samprapti, that among the Nidana Panchaga, when we look at the Samprapti. In any way, Annarasajam by meaning, that prameham, that is means apatya nimittam. Apatya nimittam is by some way means annarasam. Or when we look at the Garbhaja Vyadhi among the sevenfold classification, so Garbhaja Vyadhi is another classification where this involvement of doshas provoked by the activities of the pregnant woman is going to be the problem. In earlier classification, that means Sahajam, it is because of the Bija dosham, but in Garbhajam, it is because of the wrong activities, unhealthy involvements or engagements of the pregnant woman. That is going to be the, so it comes as a class of vikaras which are manifested because of a problem with the mother during the pregnancy. This is also to be taken into serious consideration. And that is divided into this old classification, that means Annarasajam and Dauhrudha Vimanajam. So one classification goes, these are Annarasajam. Annarasam is Aharasaram. One way, if I take it as a direct translation or a comparison, it is Aharasaram only. And Dauhrudha Vimanajam. We will come to this classification. Annarasajam shows the diseases that are occurring due to a problem with the food habit of the pregnant woman. Unhealthy food habits, specifically the foodstuffs. Specifically the foodstuffs. So they can be many types of asana doshas. We have learned all these things. Trinyapyedani mrutyum va ghoran vyadhin srujandiva. So even in a normal person, this adhyasanam type of asana doshas are going to create lot of disease. So when a garbhini is involving in that sort of asana doshas, it will not be limited to that garbhini, but it will be going beyond that level to the next generation. In Viruddhahara, we find this. Charaga makes a very beautiful explanation. Sandana doshasya. So that can happen. So they are coming under this Garbhaja Vikara. And one point what we have to take into serious consideration here, one is this asana dosha, which we have already explained, and there are many examples given. Badalaischa bhaved garbhaha kubjandha jadavamanaha pittalaihi ghaladi pingaha Sunethri Pandu Kabhatmabhihi. We find these sort of explanations documented in various textbooks. These are all examples. These are not limited to what is given as example. You can elaborate contextually according to the desha, kala. The presentations may be changing. There need not be that kubjam dhajada vamanaha. And again, this vadalaihi, pittalaihi, kabhatmabihi, this sort of explanation should not be limited to aharam alone. They should not be limited to aharam. You should consider the viharam, vicharam, and acharam as well. These are all going to be relevant, especially while we are dealing with many neonatal issues or pediatric issues, bala vikaras, kaumara bhrityam. Then you will find all these things are going to be of critical importance. Here, what does the viharam, which all things can be included in the viharam? While we are looking into the background of a case, what all things should be taken into consideration while we are dealing with the viharam? In general, viharam should cover, if I use a simple term, the environmental factors. Environmental just doesn't mean the column, but environmental means the living surrounding. It is a holistic word. The environmental factors, which includes obviously the climatic conditions, then the occupational background of the person, especially the woman in our context, the sleep pattern, the exercise pattern, the leisurely activities, other habits. All these things will be coming under this broad term viharam. But specifically, the aharam can be confined to the foodstuff, whereas many other things related with the aharanam, say for example, style. There can be many factors which we have to look into while taking the details. What is that style? Habitually eating while traveling, or putting the same meal into multiple pieces, split meal, piece meal, and they are consumed in some sort of a adhyasana type or vishamasana type. So they are more about, so the asana doshas are more about the style of eating, whereas ahara specifically involves the stuff which are consumed. Then time of eating. There are many things like very late night dinner, akala bhojanam. Then the pace of, the speed of eating, nadidruda vilambidam, isn't it? That is the way in which it is to be done ideally. But sometimes rush to the job and while gulping a few morsels of food and gulping some water. So these sort of issues should also come under some way of the aharam and the viharam part. Binge eating, stress eating. There are many new words these days to picturize these sort of habits. Then, apart from all these, the behavioral status of the pregnant woman is also identified, should be considered as important, which can be included in the vichara or achara bhavas. So they are also important. Say, for example, at one point you can find Acharya Charaka makes a beautiful document in the Charagam Shariram 8th chapter. These are going to be relevant more and more these days. Actually, while preparing for examinations, it was just a point for getting a couple of marks, but this is becoming more and more these days. See, for example, we will find that I'm not going to narrate everything. I'm not going to take a textual class at this point. See, Charaga note documents. What is that? Utkada Vishama Kadhinasana Sevinya Vadamutra Purisha Vegan Ubarundhatyaha Darunanuchita Vyayama Sevinyaha Tikshnoshnadimatra Sevinyaha Pramidashana Sevinyaha Garbhaha Mriyande Andakutchau. So there is a risk of the fetus dying within the womb. There are many precipitating factors or nidanas are explained. These are coming under the ahara, achara, vihara and vichara. Here we more find about the environmental factors and the living style. Utkada Vishama Kadhinasana Sevini. When the woman is having the habit of Utkada Vishama Kadhinasana Sevini or Vadamutra Purisha Vega Dharanam. Not all Vegas are highlighted here, but because these are going to be more specific in this context. Vadamutra Purisha Vega Dharanam. Then Daruna Anuchita Vyayama Seva. Daruna Vyayama Seva. Anuchita Vyayama Seva. Overexertion and also engaging in exercises which are not familiar, which are not accustomed with. Anuchita Vyayama Seva. Then Tikshna Ushna Adimatra Seva. Tikshna Ushna Adimatra Seva. Then Pramidashana Seva. Pramidashana Seva. That is also a very important factor. Then in such cases, Garbhaha Mriyande Andakutchau or Akale Vasramsade or Soshiva Bhavati. Soshiva Bhavati. So that child will become Soshi, afflicted by Sosham. So this is going to be a Garbhaja Vikara. Garbhaja Vikara. So here the behavioral patterns and lifestyles of the pregnant woman. This is not limited to this. There are many achara, vichara bhavas which are also important. We will find, say for example, Abhikhada Prapidanaihi Swabhrakuba Prapada Deshavalokanahi va Abhikshnam Matuhu Prapadati Akale Garbhaha. You can refer all these things. I need not explain all these things. But there are certain important, interesting factors rather. What are they? Apriya Adimatra Shravanaihi Garbhaha Akale Padati. Then Pradadottanashayinyaha Punaha Garbhasya Nabhyashraya Nadi Kandham Anuveshtayati. There can be a cord around the neck situation when Pradadottanashayini, when the pregnant woman is having a habit of Uttanashayanam. Pradadottanashayanam, continuous, habitual. Then Vivridashayini Naktam Charini cha Unmattam Janayati. See how fine the documentation is. Vivridashayini Naktam Charini, Vivridashayini Naktam Charini cha Stri Garbhini Unmattam Janayati. There can be mental aberrations for the child. Of course, take all those social and cultural habits of that particular time into granted. Doesn't matter. But we can find many similar living situations, many behavioral patterns in our current times as well. So while dealing with such a case, it may be of interest not only academic but clinical as well, to peep into the behavioral pattern, behavioral styles of the pregnant woman. Apasmarinam punaha kalikalahasila. Kalikalahasila garbhini apasmarinam janayati. The child can be apasmari. Shoganitya bhitam apachitam alpayusham va. Shoganitya stri garbhini bhitam apachitam alpayusham va janayati. So a list of descriptions we find here. A big list. I'm not going to narrate all. It is a big list, but it is quite amazing. It is quite amazing how beautifully they have documented it. Where is evidence? We have to make evidence. We can observe. You need not go for any experiment. Just observe what is happening. Even a retrospective observation will be sufficient. While you are dealing with such cases, just have an inquiry whether these sort of things have happened in the past or not. So that is about the aharam, viharam, acharam, vicharam. These things are getting explained. See, without a change in the DNA sequencing, whether changes can be happening to the physical structure or in the disease patterns, all these things are going to be or already has become very interesting points of inquiry these days. That is the good part of it. We are thinking that all these are stories, but serious inquiries are going on. And see, some branches like epigenetics, they are exclusively dealing with this without changes in the DNA sequencing, how all these things can manifest, or is there a possibility of such manifestations? So it is evolving. It is evolving, and that is when we find these sort of beautiful documentations done by Acharya Charaga in his Sharirasthana. Then one more point we have to find regarding the Dauhrada Vimana. We may skip it. We may miss it. We will rush through because we have only a couple of minutes left. This Dauhrada Vimanam is generally should be understood in different types. Generally, we think that that madrujam hyasya hridayam maduscha hridayena tat sambaddham tena garbhinyaha neshtam shraddha vidharanam. That is what we find about Dauhridam. That dvihridaya chanari. So generally we finish it. That's all. But sometimes we can assume that this Dauhridam represents the likes and dislikes of the fetus. Okay, fine, taken it for granted. But Dauhridam can be an attempt of the doshas of the pregnant woman, not the child or the fetus, of the pregnant woman to avoid a slipping into the Kobhavastha. That is also a possibility. When it is in the Chayavastha, Pradvesho Vritthihedushu Viparida Gunechacha. So we should look into the Dauhridam from that viewpoint as well, and it should be corrected. Otherwise, this will be slipping into a dosha gobam, creating lot of issues within the mother, in the mother as well as the fetus. And that can be manifesting as a Garbhaja Vikara. And the importance is that when it is Garbhaja Vikara and we are treating it with afterbirth, many of these things will be uncorrectable. So that will be labeling it as an Asadhya Vikara. And ojas of the pregnant woman is going to be very critical at this point. As long as the ojas is intact, it will help the fetus to pass through such critical situations. Then the Dauhrida Vimana history is also very important. And the Dauhrida Vimanaja Vyadhi need not be understood as just a mental like or dislike. That is one point. Just as a mental like or dislike, but it should be connected with the dosha status of the mother as well as the fetus. So it should not be just overlooked while dealing with the details of the case. So that is one point. Then we will, I think there were a couple of more questions in this regard, which we will find in our next session. Of course, there are a couple of important references in the chat box. Anything to say on how much duration of exposure to these factors leads sufficient dosha imbalance that can lead to particular conditions? Okay, I'm copying this question, and we will deal with these issues definitely in our next session. As I mentioned earlier, this is just a capsule sessions in the morning as part of some sort of a swadhyayam. It is not like a webinar where we can take all the 1.5 hour sessions. Everybody will be rushing through their daily routine in the morning. So this is just a reminder, many brushing up of what you have learned earlier. And for those who are entering into the clinical practice, my attempt is, or the entire attempt of this session is, to make them conditioned with an Ayurvedic way of clinical methodology. The clinical methodology in Ayurveda is not something like what you learn in the modern textbooks. There may be many similarities, but it has got its own way of looking at issues, its own way of understanding the problem, and its own way of sorting it out so as to come with a proper intervention. So here we stop today. We'll be meeting again on Saturday morning. Thank you very much. And here we conclude. Vishajam sadhuvrittanam bhadram agamasalinam abhyastakarmanam bhadram bhadrabhilashinam. So please post your ideas, your queries, your convictions in the group, so that many of these things can be discussed in our future session. We'll be going very slow. We don't have anything to complete in a prescribed time. We'll be moving very slow. So please share your ideas, convictions, doubts, queries, experiences in the group, so that we can take one after other in our discussions. Thank you very much. Have a good day.